I hope that everybody had a fantastic Independence Day celebration. I know I did, and I sure hope that everyone still has their fingers and their toes intact, because where I live, there were certainly a lot of people shooting off fireworks. Welcome everyone to Kristen's Nuggets of Knowledge, and today is part 2 of the Federal Employee Health Benefits and Medicare learning sessions. Are you hungry to go grab a couple nuggets of knowledge? I know I am. Let's go, shall we? Before we get started, I have a question and favor to ask of you. If you believe that it is important for Medicare insurance agents to not only be licensed to sell in their states, but also be certified through the government and their carriers, aka do tests every single year to make sure that they know their stuff, please click that like button. I am going through all those testings right now and need all the support that I can get. So, moving along, FEHB, Federal Employee Health Benefits, must be equal to or better than Medicare insurance. This makes it what is called credible coverage. That means that if you want to have just your FEH benefits, you can. You don't have to have Medicare, and then later on, if you decide to get on Medicare, you won't have a penalty associated for enrolling later on down the line. So that's something that's good to note. But I do want to nail this point home. I highly advise you to get with your insurance provider. Sit down with them every single year. Talk over the different options that are out there with the federal program, because there are several different health insurance options. So just like any other insurance program, you need to be on top of things, looking at all the available programs, just taking a look at yourself, your health, your financial status. Look to see what plan makes more sense to you. And then also, if it makes sense to tack on Part B with Medicare, because we always want to have that Part A in place, especially if it is premium free. Now, every single FEHB plan is going to be different. It is credible coverage, so it is equal to or better than original Medicare. More often than not, though, it's going to be better, but it just all depends on the plan. There are several different things that they made note of in the documents that I've been looking through that FEHB plans may not cover. So if this is possibly your medical history or something that you think may need taken care of, I would look into the plan that you are on to see if it is good for you to tack on that Part B or look at another option for your insurance. Because things like orthopedic and prosthetic devices normally are not covered on an FEHB. Other things include durable medical equipment, home health care, and medical supplies. So all of those are really big ticket items. But please, before you make any changes, sit down with your insurance provider. FEHBs work very similar to a Medicare Advantage plan, but they are not Medicare insurance. They are overseen by the Medicare and Medicaid services just to make sure that they are, in fact, credible coverage. That's the only thing that they have to do with Medicare. And they are not a Medigap or Medicare supplement policy. They don't supplement Medicare. They can coordinate with original Medicare only, not with an Advantage plan. With that being said, you may have an HMO plan for your FEHB. So maybe actually having Part B in place may not be a bad idea if you're looking to utilize services outside of the network. Now, if you do have both Medicare and an FEHB in place, you may wonder who pays first, because you may want to know what card to keep in your wallet. Now, because this is not a Medicare Advantage plan, meaning your original Medicare is actually being provided to you by a private insurance company, Medicare is actually on an FEHB coordinating with your insurance. So that means have both your Medicare card on top of your FEHB plan card. More than 90% of the time, if you are a non-active, non-employed, and you are on a non-active, non-employed coverage through FEHB, 90% of the time, Medicare is going to pay first. But the good thing is because they coordinate together, you don't have to worry about filing claims with both insurances. That is all that I had planned for you today, as we will continue this discussion about federal employee health benefits plan and how it coordinates with Medicare. If there is a topic that you would like to hear about, please drop me a line. I enjoy the opportunity to be able to serve you. Thank you so much for tuning in. Have a blessed rest of your week, and we will see you next time. Bye.